Good afternoon. This is JC, St. Louis's oldest living hippie, and I'm on Social Security and Medicare supplemental insurance. So I'm pretty familiar with what's going on with Medicare right now. And Medicare Advantage is not really Medicare. Medicare Advantage plans are administered by insurance companies, and Medicare pays them to administer the plan. Well, the problem is very simple that they can choose and do what they want with you and with your health because they are kind of like the old PMOs. You can only go to certain doctors, and you have to have procedures pre-certified that you wouldn't have to have on regular Medicare. They also now, Trump and the guy, I think he must be the head of Social Security. I'll tell you the name. You'll hear the name in the thing. Um, he could very easily make every person who's on Medicare Part B and D become Medicare Advantage enrollees, and that move us from regular Medicare without our permission to Medicare Advantage plans, where we'd have to ask permission for anything we do, any meds we got, anything like that. And with the Cigna Health Plan, which is the Medicare Advantage health plan, they got in trouble a couple of years ago because they were denying 65% of the claims that people put in for procedures they needed to improve their health, and that would have normally been approved by regular Medicare. Turns out they were using a computer, and the computer was doing all the denials when a human is supposed to see them, but a human wasn't seeing them. And I think this is a long article, but I'd like you to listen to it if you can through the whole thing, because this tells you exactly what might be happening in the next few months, and we have to stop it. So let's listen to this.
Trump weighs major gift to for-profit insurance industry, Medicare privatization. The Trump administration is considering enacting a policy that would automatically funnel seniors into for-profit Medicare Advantage plans, which critics say would set Medicare on the path to full-scale privatization. Chris Klomp, the Trump administration's Director of Medicare and Deputy Administrator of the Centers for Medicare and Medicaid Services, CMS, told Stat last month that enrolling seniors in Medicare Advantage, MA, plans by default is something that we're thinking through. MA plans are funded by the federal government and run by private insurance companies such as United Healthcare and Humana, both of which have been accused of improperly denying necessary care to patients and overcharging taxpayers. The default enrollment scheme was floated in the far-right Project 2025 agenda that President Donald Trump has repeatedly tried to disavow. Currently, older Americans who have received Social Security benefits for at least 4 months before they turn 65 are automatically enrolled in traditional Medicare, and they can choose to enroll in an MA plan as an alternative. Another bad idea straight from Project 2025, Representative Mark Pocan, Democrat Wisconsin, said in response to Klomp's comments on the proposed default enrollment change. Medicare Advantage is private, for-profit insurance that overcharges American taxpayers by billions every year and regularly denies seniors the care they need. Making Medicare Advantage the default option hurts patients and taxpayers, Pocan added, but it will make insurance execs a lot of money. With Mehmet running the agency, they can move incredibly quickly to make that happen, and they are. Klomp said no plans have been finalized, but defenders of traditional Medicare warned that CMS, headed by Mehmet Oz, who during his 2022 U.S. Senate run backed a plan entitled Medicare Advantage for All, could try to swiftly ram the change through without public input. With Mehmet Oz running the agency, they can move incredibly quickly to make that happen, and they are. Alex Lawson, executive director of the progressive advocacy group Social Security Works, told Common Dreams on Friday. They will not explain it to the people, because the people hate the idea. Instead, They say change the default option and other policy jargon to try and hide the fact of what they are doing, privatizing Medicare. They want to remove the guarantee of Medicare, warned Lawson, and replace it with the same private insurance giants that make billions denying healthcare, especially to those who need it the most. Experts say making Medicare Advantage plans the default enrollment option for seniors would likely decrease traditional Medicare enrollment dramatically. Given massive overpayments to Medicare Advantage plans, potentially $1.2 trillion over the next decade, according to one independent estimate, a large increase in MA enrollment would be sure to drive up costs and monthly premiums across the board. A report released last month by the Congressional Joint Economic Committee estimated that MA overpayments led to premium hikes of $212 per Medicare Part B enrollee last year. Since 2016, MA overpayments have added an estimated $82 billion to Part B premiums, the congressional report found. Traditional Medicare beneficiaries, who are not enrolled in MA, bore roughly $6 billion of that burden. Under one scheme floated last year by Representative David Schweikert, Republican Arizona, eligible Medicare recipients would be automatically enrolled in the MA plan with the lowest premium available, unless they actively decide to opt out. Once enrolled in an MA plan, individuals would be unable to switch plans for 3 years. Wendell Potter, a former health insurance executive who now champions Medicare for All, warned Friday that under Schweikert's plan, seniors would be locked in a plan that the government chose for them, that has a limited network of doctors and hospitals, that makes them pay the entire bill for services they might receive outside of that network, and that denies coverage for medically necessary care far more than traditional Medicare, for 3 years. In addition to weighing the default enrollment change, the Trump administration has recently delivered smaller-scale but significant victories to MA insurers, including by boosting federal payment rates, vowing to a massive industry lobbying blitz, and easing rules around the marketing of MA plans. David Lipschutz, co-director of law and policy at the Center for Medicare Advocacy, said Thursday that the latter move represents a rollback of consumer protections, which gives in to pressures from the insurance industry and those who sell their products.
Well, there you go. It's straight out of the 2025 playbook, and they're going to try and do it. So we have to stop it. Lawsuit, protest, whatever we can do. Please repost this. I don't know if you listened to it this far, but please repost this. And that Oz Mehmet, or whatever, Mehmet Oz, that asshole, somebody used to ram their foot right up his ass so hard, he tasted it in the back of his mouth. This is JC, St. Louis's oldest living hippie, saying, fuck you, Donald Trump. And to everyone else, pox some more, Jack, and keep on trucking.